Let's go back now to look at why there might be irritation in the respiratory organs. It might be exposure to chemicals, it might be exposure to mold, or it might be exposure to certain foods. And so the 5 main allergen foods are dairy, and that's one of the first symptoms of an intolerance to dairy is excess mucus in the respiratory organs.
Hi, I'm Barbara O'Neill, and today we're diving into a topic that affects so many: how to treat chronic sinusitis and respiratory infections without antibiotics. These issues can be frustrating, with recurring symptoms like congestion, mucus buildup, and breathing difficulties. But here's the good news: there are natural remedies that work with your body to bring relief and healing. In this session, I'll share practical, effective tips to cleanse and restore your respiratory system using simple, natural methods.
Oh, so excited this morning. I coughed up 4 lumps. Where's that coming from? It's from my tonsils. I know it's from my tonsils because I'm not coughing here. It's just coming from my throat. And so when I go home, I do oil pulling, which is coconut oil in the mouth, swishing around 10 times and then release it out, either in you call it a trash can, or you don't call it plug hole. Don't put it down the plug hole, the sink, you call it sinkhole, because coconut oil, when it goes hard, what happens? Solid. Don't put it down the drain or you'll be in trouble. And often after that, there's a cough up, because what it's doing, the name's called oil pulling. It's coconut oil in the mouth, and you swish, and you're pulling waste from in the lungs. You're pulling waste from the tonsils. You're pulling waste from the sinuses. You're also pulling waste from the tongue. You're pulling waste from the glands under the tongue. Waste is being pulled from the blood vessels under the tongue. That's why it's called oil pulling. And Bruce Fife, F-I-F-E, he's written a whole book on it. One wonders how he could write a whole book on oil pulling, but he has. And he shows that just this simple thing, I've only known about it for about 10 years, but apparently it's been quite common all through Asia, is oil pulling as a simple little way of just pulling waste out of these areas. So if you have a cold, if you have a sinus, if you have any chest, a part of what you do to the body to bring about healing can be oil pulling. Now, because I travel a lot and sometimes I'm not breathing in the breast air, especially when I'm on planes a lot, I regularly oil pull. And I'm amazed when I oil pull that I'll often cough up a lump. And you know what I think? If I didn't oil pull, where would that lump stay? And if I didn't go up the big hills and down in the morning and I didn't cough up that lump, where would it stay? Well, I'd have to get more of a cold, because that's what a cold is. It's a house clean. And if you give the body the right conditions when the house clean comes, it can actually go through your body very quickly. Maybe in a couple of days, and you'll be right. Nose breathing. I want to show you something else about nose breathing, and this can be particularly helpful for people who have breathing problems in the chest, particularly bronchitis or asthma. And I'll give you the story of this professor. This Professor Buteyko was a mechanic in the First World War, and he was a very clever mechanic in the Russian army. He knew engines, so he knew how to fix them. Doesn't that make sense? What's the good of having a mechanic fix your car if he doesn't even know how the engine works? And when he came out of the war, he analysed. He thought, if I knew how the body works, I think I could fix the body. So he went to train as a physician, a doctor. He became a professor. And he tells the story one night, because sometimes those poor doctors, they're on 24/7 call when they're training. So one night he looked in the mirror or was the reflection of a door, and he was shocked at what he saw. He was overweight. His jaw was just hanging down. He looked terrible. He got a shock, stood up, closed his mouth, put his shoulders back, and that reflection was a confrontation to him. And so he started to breathe differently. He started to breathe only through his nose and not through his mouth, because the drop of the jaw shocked him. And he started to realize the importance of nose breathing. And he came across a man with an asthma attack one day, and he told the man to close his mouth. And he told the man to hold his breath. And within half an hour, the asthma attack had eased. So that's when he went to the drawing board. And that's when he discovered the wonders of carbon dioxide. Carbon dioxide, as I mentioned in an earlier talk, and we talked about it a bit yesterday, you need carbon dioxide to get oxygen. Remember the 4 docking stations on the hemoglobin? 4 molecules of carbon dioxide are necessary to pick up 4 molecules of oxygen. 2 molecules of carbon dioxide, you're only going to get 2 molecules of oxygen. And remember, in the cell, if the cell's got oxygen, we've got 18 times more energy coming out of that cell. And he discovered the nose. You see, mouth is for talking, mouth is for singing, mouth is for eating, for drinking, no, nose is only for breathing. Mouth is not for breathing. So last time I had a cold was May last year in Germany, and I decided to test and only nose breathe with my cold. Could I do it when I had a cold? Well, I had to have about 10 tissues in my pocket when on my morning walk. And I nose breathe through my whole cold. Because when you force yourself to nose breathe, it opens up. Even a deviated septum can open up. And please, I would never have an operation to open the back of my nose. When you understand that all you have to do is nose breathe, and it will naturally open it up.
When you practice nose breathing consistently, it helps filter, warm, and humidify the air you breathe, which protects your respiratory system. It also supports the production of nitric oxide, a gas that helps open up airways and improve oxygen delivery to the cells. For those struggling with chronic sinusitis or respiratory infections, this can make a world of difference. Combine nose breathing with regular steam inhalations, using essential oils like eucalyptus or peppermint to further ease congestion. Another tip is to ensure proper hydration. Drink plenty of water throughout the day to keep mucus thin and easier to expel. Additionally, avoiding dairy products can reduce mucus production for some people. Remember, your body is designed to heal itself, and simple adjustments like these can help it function at its best. Make these small changes, and you may notice significant improvements in your respiratory health.
But let's go back now to look at why there might be irritation in the respiratory organs. It might be exposure to chemicals, it might be exposure to mold, or it might be exposure to certain foods. And so the 5 main allergen foods are dairy, and that's one of the first symptoms of an intolerance to dairy is excess mucus in the respiratory organs. Also, the hybridized wheat, we've discussed that a couple of times. The hybridization of the wheat in the 1950s produced structures in that wheat that are not known in nature. And some people with a cast iron stomach who don't eat it, all day, every day, they don't appear to be many symptoms. But one of the symptoms of an allergy to wheat is excess mucus. Oats is high in a plant chemical called lectins. I think you call it oatmeal. We call it oats in Australia. And lectins, if they get into the blood, they increase inflammation. So if someone has an allergy of any type, they're best eliminating the oats. Once the allergen's been or the allergy symptoms have gone and everything's settled back to normal, maybe they can have a little bit. You'll quickly see. If they have the oats and then the mucus appears, what's the body saying? No, go to millet, go to rice, go to something else. Peanuts are commonly contaminated with mold, and so they're best kept away if there's an allergy. And refined sugar, basically it just is like kerosene on a fire with any sickness. So when I was at Misty Mountain a few years ago, we had a nurse who was an ear, nose and throat specialist nurse. So what she does, she assists the surgeons and the doctors that are treating sinus. So they do a lot of sinus operations to clear out the sinus. She said, you wouldn't believe the green slime that we pull out of sinuses. And she said, and every specialist acknowledge is that it's fungus. So then my question is, well, why is it there? And then I was reading, and I think I've quoted this in my book, that in the 1990s, a group of doctors in the Mayo Clinic declared through their research that sinus was fungus. So why is it there? That's what I want to know. Why is it there? Well, when you get someone that's got an allergy to these foods and there's common excess mucus building up in that area, then the microorganisms evolve into or change roles into a cleanup or cleanup team, you could call it. That's called yeast and fungus. That's what they do. They clean up the area. But because the allergens continue and the mucus continues, then the fungus, the yeast, have a continual food supply there. And so they go and get all of it cleaned out. And by the way, because they're having to breathe through their mouth, then the little canals at the back of their nose are getting smaller and smaller. And so then the next option is to have it drilled out. Yes, it's true. It does happen. And sometimes it's blocked up so much it bends, and it's called a deviated septum.
This build-up of mucus and irritation in the sinuses isn't just about the fungus or yeast, it's about what's fueling them. When allergens like dairy, wheat, oats, peanuts or refined sugar are regularly consumed, they create the perfect environment for these microorganisms to thrive. The mucus they feed on becomes a constant supply, allowing them to multiply and keep the irritation going. To break this cycle, removing these trigger foods is essential, but it doesn't stop there. Supporting the body's ability to detox is equally important. Regularly using steam inhalations with essential oils like tea tree or eucalyptus can help clear out the sinuses naturally. Drinking herbal teas like ginger or peppermint can soothe inflammation and improve circulation. And finally, ensuring proper nasal hygiene, like using a saline rinse, can help keep those nasal passages clear and prevent further irritation.
Get a herb. This is quite a remarkable herb. It's an expensive herb. We can't get it in Australia, so every time I come to America, my staff say, please bring some golden seal back with you. And when I get into Australia, we get it as the powder. So when I get into Australia, I have to declare everything, so I write herbs. Now, did you know in Sydney Airport, you can't fly in before 6 a.m. and you can't fly out after 11 p.m. So at 6 o'clock, you've got about 10 planes from all over the world all landing. So the Aussie immigration, they're moving you through quick. And they come up and say, what do you got? Herbs. What are you going to do with the herbs? Make a herb tea. I'll go through. And we do make a herb tea with some golden seal. But what if you can get the golden seal powder? Golden seal is called king of tonics to all mucous membranes. And all your respiratory is lined with mucous membranes. So it has a tonic effect. But something else very interesting about golden seal, it's a huge or a broad range antimicrobial. It's antifungal, anti-yeast, antibacterial, anti-staphylococcic. Did you hear that? There's not a drug that will kill staph, golden staph, but this herb will. So we get people to sniff it. Now, did you know when you make a fist, you've got a little dip right there, and it's called the snuff dip. And they used to put snuff in there and you'd sniff it. Well, that's what you do with the golden seal powder. Sniff it up into the sinuses. Don't go, or it'll feel like the top of your head's about to blow off. Just little sniffs. Just do a little sniff with one side and a little sniff on the other. That's a very expensive herb, but you only need the slight little amount. So that's what we got this lady to do. Twice a day she would sniff up the golden seal. She said to me after a couple of days, she said, Barbara, it's like I'm blowing green barley out of my nose. And when she told me that, because we do give green barley, I thought maybe she breathed in the green barley, but you know what she was referring to. Remember what that is? Ear, nose and throat specialist nurse said, we pull green slime out of that nose. Well, that golden seal was loosening the build-up and she's blowing it out. Don't get scared when you blow out green slime. Rejoice. Where was it before you blew it out? So this lady went home a very happy lady. She had direction. She now knew which way to go. I didn't hear anything. 2 years later, a lady came to do our program. She said, you don't remember me, do you? I said, I'm trying. She was that lady. She'd lost 10 kilos, which is 20 pounds. She looked great. She said, I've got a great story for you. She said, I have had no headaches for 2 years. See, their headaches were due to the build-up in her sinuses. She said, I don't have sinus problems anymore. Yes, I did blow out green slime for about a month. She said, I have stopped all of those foods. She said, I'm now a nose breather. She was a mouth breather because it was just so blocked up. The best way, if you're blocked up, is to blow your nose, and if your mouth tries to open, tape it up. And you will, as you breathe through your nose, you will open the nostrils. That's the good news. Remarkable story. Now, what would have happened if she hadn't come to our retreat and learnt these ways? You know what Misty Mountain's called? Misty Mountain Lifestyle. It's not Lifestyle Centre anymore. It's Health and Education. Because our aim, my aim, is to teach you how to be your own doctor so that you go home and you do it. And as you do it, you do this. You listen. You listen, and sometimes the body will go, yay, and sometimes the body will go, oh, can you go a little bit lighter on the sniffing of the golden seal, please? So you'll feel your way.
Golden seal truly is a remarkable herb, and its power to heal mucous membranes and fight infections amazes me every time. Along with its antimicrobial properties, it also strengthens the immune system, making it an invaluable remedy for chronic sinusitis. When sniffed gently into the sinuses, golden seal works its way through the mucus, breaking up years of build-up and allowing the body to expel it naturally. But that's not all. To enhance its effects, I often recommend pairing it with warm saline rinses. These rinses help clear debris and keep the nasal passages moist, creating an environment where healing can thrive. Combining golden seal with herbs like echinacea or thyme can also give the immune system an extra boost. By staying consistent and patient, people often see lasting results. When mucus starts clearing and breathing becomes easier, it's a clear sign that the body is on its way to recovery. Thank you for joining me today as we explored natural tips to treat chronic sinusitis and respiratory infections without antibiotics. Remember, your body has an incredible capacity to heal when given the right conditions. From simple remedies like oil pulling and golden seal to the power of nose breathing, these steps can make a big difference. If you found this helpful, please like this video, subscribe to the channel, and don't forget to hit the bell icon